Hello, everyone. This is Abigail Goodwin here. I wanted to do my presentation on something that is near and dear to my heart, and that is asthma, which is a chronic respiratory disease. So the definition of asthma is a chronic or long-term condition that intermittently inflames and narrows the airways in the lungs. So what does that mean? So the way that I describe it is that right here in the bronchial tube, swelling occurs when an inflammation takes place, and extra mucus is secreted in this airway, which we need, but in asthma, more mucus is exposed, which is not a good thing because it can get into our lungs and we can develop pneumonia. So our muscles tighten and it's just harder for asthmatics to breathe due to this. So asthma mainly develops in childhood, but many adults actually can get asthma. But it mainly occurs in childhood, and many people can outgrow it. Personally, my father and my brother, the lucky dogs, as they got older, they grew out of their asthma. Now, my mother, my sister, and I have not. So a patient's asthma can fall into one of the four categories, which is mild intermediate asthma, mild persistent asthma, moderate persistent asthma, or severe persistent asthma. So what are those? Okay. The mild intermediate is when a patient can have a minor symptom at least once a week. So mild persistent asthma is where minor symptoms show up, but it starts to occur 2 times a week. Now, moderate persistent asthma bumps up the symptoms to once a day. Then lastly, there is severe persistent asthma, where one is having issues throughout the entire day and night. All right, next up are the causes of asthma. So currently the cause of asthma is unknown. Physicians have some theories that they believe are the causes of asthma. And the first one that we're going to look into is genetics. So genetics seems to play a role for certain people that have asthma. It tends to occur when someone has a family history of it, so they're more susceptible to the disease. For example, as I stated earlier, my mother, her siblings, my father, and my siblings all have asthma. So I was predisposed to this disease, as we say. So when I was a baby, my doctors were prepared for me having asthma as I grew older. So another cause is the environment. This can play a very big role in asthma because each asthmatic has their own allergens that set them off. You know, some people can have some in common, but some of them are just completely different. Like me and my sister, dust is one thing that sets us off. So if it's in the air, someone dust surrounds us, we instantly have a reaction of sneezing and coughing. But it's not only allergens in our environment, it's also viruses. So when we're young and developing as a child, our immune system can be weakened, and being exposed to a virus can weaken our airways and it can actually cause asthma. So lastly, the immune system plays a role in this cause. So scientists have actually identified more than 100 types of immune cells in the immune system that play a role in causing asthma. Many of the cells actually play a role in the inflammation, and that's what asthma is, an inflammation in the airway of the lungs. All right, so the symptoms for asthma all deal with breathing. The first symptom, the main symptom I would say, is coughing. So many asthmatics would call this cough a wet cough, and that's due to the extra mucus that's being produced in the airways. So an asthmatic will cough in an attempt to bring up this excess mucus out of the bronchial tubes so that pneumonia doesn't set into their lungs, which can be very dangerous. Now, the next is wheezing. Wheezing, as my doctors described, is like breathing through a straw. It's like a rattle noise when they listen to your lungs. It just sounds like a bunch of rattling. Now, it can be painful because the airways are closing due to the inflammation, so the breathing can become more difficult. Now, next is difficulty breathing. Now, that is because of the bronchial tubes narrowing. So air is trying to push its way to the lungs, but it's getting harder and harder because the mucus is blocking the air from getting to the lungs. Now, in my opinion, shortness of breath and chest tightness goes hand in hand. These symptoms make someone feel like an elephant is sitting on top of their chest. You're just trying to breathe, but something is preventing you from doing so. So again, the air is struggling to find its way to the lungs. For myself, shortness of breath is a major cause of my asthma attacks. Not being able to breathe can start to cause a person's level of anxiety to rise. So then we start to believe that we're not getting enough oxygen, so we start to hyperventilate, which is not helping us at all. So during an asthma attack, the airways become extremely inflamed. The muscles that surround the airways then begin to tighten, which is called a bronchospasm. Then even more mucus is produced, causing breathing to become even more difficult for us. All right, so as common as asthma may be, there are only 3 ways to diagnose a patient. So the first one is a medical history. So with medical history, a pulmonologist will investigate how many times you've had a respiratory infection. They're going to ask you to think back and track your symptoms, when they occurred, how severely, what the triggers were, etc. The doctors may even ask if you have any allergies, if you know if you have any allergies. Okay, so the next is the physical exam. So during the physical exam, a pulmonologist will use a stethoscope to listen to your lungs. While they're doing this, they're going to be listening for signs of asthma, such as wheezing. When the doctor finishes listening, then they're going to start to begin to look for signs of asthma. They really like to look in your nose for this one. So they're going to use an endoscope to view into the nostril to locate swollen nasal passages and signs of a runny nose. The last place the doctor's going to look will be your skin. So they're going to examine the skin to see if they see a rash that's going to be red, itchy, or even scaly. So this skin condition is called atopic dermatitis, or eczema, as I like to call it. So eczema occurs when you're exposed to an allergen that you're allergic to. So it normally occurs alongside hay fever and asthma. I like to call it the trifecta because I have all 3. They love to play off of each other and all act up at the same time. So the last diagnosis technique a doctor can use is diagnostic testing. So there are a multitude of tests. The first one is a PFT, which is a pulmonary function test. So this test is going to be where a patient breathes in and out through a tube. The tube is connected to a computer that will read our vital capacity. The next test is a BD test. This is called a bronchodilator test. So the BD test is where the doctor measures how much and how fast air moves during inspiration and expiration. So it measures this before and after the patient would take an inhaled medication, preferably albuterol, and albuterol is going to relax the airway muscles. So the doctor's trying to see if the albuterol is going to help you to be able to breathe more air during inspiration and expiration. All right, the next test is a PEF test. PEF stands for peak expiratory flow. And PEF test is to measure how fast you can blow air out. Now, this is a test that I do not like. So the doctor or respiratory therapist will tell the patient to take a deep breath in and then release it as hard and as long as you can. It is not a fun test. It takes your breath away, but it can help the doctors diagnose if you have asthma or not. The other test is a bronchoprovocation test. Now, this test is to view or see how one's airways reacts to inhaling specific allergens. So the patient's airways will or will not tighten depending on what they inhaled. And the last test is a scratch test, which is another test that I do not like, but it is a very helpful test for allergists and or pulmonologists. So the scratch test is where a doctor will place specific allergens on the patient's arm or their back. The substances are then pricked or scratched so that the allergen goes under the epidermis. So the next step is to wait 15 to 20 minutes to see which substances the patients have a reaction to. So this can help the allergist and pulmonologist. They can either be the same doctor, as in mine, he is certified as a pulmonologist and an allergist. This helps him to let me know what to stay away from. So, like I'm allergic to oak trees. So if I get around oak trees during springtime when they're blooming, my allergies start to act up, which then foresees my asthma to start to act up. So this just helps the patient to be aware of what they need to stay away from. There is no cure for asthma, but there are treatments that can help a patient manage their symptoms. So the treatments are going to depend on the severity of the asthma, your age, and your response to the treatments. So the first one will be controlled medicines. So controlled medicines are medicines that a doctor will prescribe to take daily to control one's asthma. So those, for example, will include a corticosteroid. So those are used to reduce the inflammatory response, and these medicines may be inhaled through an inhaler. So that will be albuterol would be a good example of that. So the next one is biologics. So biologics are medicines that target a person's response to specific allergens. Now, these are injections that one will get once a week. The next one is leukotriene modifiers. So these reduce the effects of leukotrienes, which are released in the body as a part of a response to allergens. So they cause the airway muscles to tighten. Next are what we call LABAs, and the LABAs means inhaled long-acting beta-2 agnosis. So these help to reduce the narrowing of the bronchial tubes by keeping them open. Okay, so the next form of treatment will be short relief medicines. Now, these are only recommended when one's having an asthma attack because, like the name says, these are not long-term help. These are short-term help. They're to provide instant relief. So they include SABAs, which stands for short-acting beta-2 agnosis. And those are medicines that quickly relax the muscles around the asthmatic's airways that are tight due to the asthma attack. Okay, next is oral and IV corticosteroids. Those are used to reduce inflammation just a lot faster, especially the IV, because it will go directly into your bloodstream. And then the last one is short-acting anticholinergists. They're medicines that open the airway quickly. Now, another treatment would be emergency care. So when someone would go into the ED, they would be treated with the medications that I just listed. But if their symptoms worsen or do not improve, they would be treated with oxygen therapy. So oxygen therapy is where a tube is going to be inserted into the patient's airway, or the doctor could use ventilation, which is where a tube is going to be inserted in their airway. But both of these treatments involve a mask that's going to be placed over their face to help the patients breathe. So the last treatment would be if none of the other treatments have helped, and that's going to be procedures. So the procedure that a doctor would perform will be a bronchothermoplasty. So in this procedure, your doctor will enter the airways through the mouth with the bronchioscope, and this helps your doctor to see inside your airways. So the doctors then will apply heat to the muscles along the airways to make them thinner and to help prevent constriction. Now, lastly, we have some resources that can help asthmatics. So the first one is the AAFA, which is Asthma and Allergy Foundation of America. Now, they pride themselves on being able to provide resources for asthmatics, their families, and care providers. So one of the resources that they are very involved in is education. So they offer many educational tools to help people better understand asthma and how to live better with the disease. So they offer education through classes that you can do with other families, or if you would prefer to do it online by yourself, you can do that as well. So the AAFA also teamed up with the CDC, which is the Centers for Disease Control and Prevention, to create several programs that will allow staffs in schools to be educated on how to better deal with students who have asthma. So that way, when an asthmatic is in school and they're having an attack, they can feel comfortable knowing that the person taking care of them knows what they're doing until they can get to a hospital. So AAFA has also worked with Peer, which is a platform for engaging everyone responsibly. So Peer allows patients to share health information with researchers and each other on their own terms. So this helps doctors and researchers better understand the disease and be one step closer to possibly finding a cure. So the last resource that I believe is the most important is to have a specialist. So as I mentioned before, I have a specialist. He is an amazing doctor and he is certified in pulmonology and allergies. So he's a pulmonologist and an allergist. So one thing that can help younger kids that, I use this for my nephew, is for the parents to keep an asthmatic diary. So when he comes over and if he's having an asthma attack or he's just showing some symptoms of his asthma acting up, I write down what he was doing. So if he was running and playing, laughing, if he was outside and maybe got into some grass, just to see what's going on and what he could be allergic to, because he's 6 and doctors do not like to diagnose kids that are 6 and under with asthma because it could be something else. They aren't sure if it's asthma yet. But this tool can be helpful for the doctor as well because it contains all the information of the attack since the last doctor visit. So no matter what resources you use, they can all be helpful in understanding one's asthma and how to properly manage this disease. Now this is just a works cited page for on my second slide when I gave the definition of asthma. This is the source that I got it from. And this last slide is just giving credit to all the images that I used on my presentation.